Hi, and welcome back. I am Kanisha Leggett with KUMSOT, and today we will be discussing some pediatric evaluation tools, different settings that occupational therapy can work in with the pediatric population, and then some assessments that can be utilized across the board of those different settings. So, a couple of evaluation tools that I have recently learned about have been the Peabody Development Motor Scale 2, which looks at fine motor and gross motor. It has an age range of 1 month to about 6 years. Another assessment tool that I read on is the Sensory Integration Praxis Test, known as the SIP, and the ages that are appropriate for it is 4 to 8 years, and it also looks at visual processing. It looks at praxis. It reviews vestibular, sensory motor, and somatosensory. Another common one is the COPM, the Canadian Occupational Performance Measurement, and that takes a view of self care, leisure, and productivity, and that can be used with all ages. So that one is very flexible. The other one that we've reviewed is the Beery VMI for visual motor integration, and that one looks at ages 3 to 18, and it looks at non-motor visual processing and motor coordination, and it's a screen. You can also always use the sensory profile with the children, and the BOT test too as well, which is the Brunick's Osateski test of motor proficiency, and that test looks at fine motor and gross motor, and it can take anywhere from 45 minutes to an hour. One of the benefits of that test is that it has subtests. So, when considering choosing an assessment, you always want to consider the length of time that it will take not only to administer the test, but also to score the test, which is why when you use tests that have subtests, it'll let you focus in maybe on one aspect or spread the test out over multiple sessions in order to complete, especially since working with the pediatric population. Sometimes they don't possess the attention span for a complete test to be completed. They fatigue easily, distracted. So you want to take that into consideration when choosing the assessment tool that you're going to use. Also, the setting may dictate the type of test you provide as well, because you're only given a certain amount of time for your treatment session. So those are just some things you want to consider when choosing your assessment tools, not just what you're trying to address, what deficit or occupational challenge you're actually addressing, but also the time frame that you will have with that child in order to maximize those minutes that you are provided to give treatment to the child. The next thing we're going to talk about are the different settings that occupational therapy can work in. There are multiple settings that occupational therapy can work in. That is the beauty of OT. We can transition across so many areas, even places that you might not have thought that OT would be appropriate. You can always find something that occupational therapy can assist with. So, the few that I'm going to touch on today are going to be hospital, school based, home, private practice, and then daycare or child care centers. The few things that you will notice that will vary with each one will be the funding that is received in the various settings. Some receive private funding, some receive government funding, some receive private pay. Some of those are through donation, and so that's one of the difference. As you go setting to setting, you should be aware of where the funding is coming from in order not only to ensure that your documentation is appropriate for them to continue to receive the funding, but also so that you know what your limitations or what type of interventions you are allowed to provide in those settings. The other thing that varies setting to setting is also the focus of care. So, when you're in a hospital setting, the focus is typically on acute and chronic conditions. When you move to school based settings, their focus is on educational progress, preparation for higher learning, schoolwork, handwriting, attention. When you go to home, you then are looking at the child's function or role in the family's routine, or the child as a member of that family, what they are responsible for, and how to help them progress in completing their daily occupations. When you go to private practice, this is where it varies a little more because you will be working under the guidelines of whatever that agency's mission is. So if you're in a private practice that strictly focuses on sensory integration, then that's where you would be guided. If you're in one that focuses strictly on feeding and swallowing, then that's where your treatments will be guiding. So private practice can be either all encompassing or it can be specifically focused. The last one is the child care center. Now, typically in a child care center, those are children that are underage for attending school, and thus their focus is usually on developmental areas, developmental progression, nurturing, safety, health, education in that area. So, a few assessments that I think might be able to be utilized across the board in the various settings are the Peabody and the Berry VMI, as well as the sensory profile screen, because they are quick and easy to administer, as well as they are easy to grade. I find that if you choose a test that has subtests, that also transitions across the board, because then it allows you to not only focus your treatment on one area, but it allows you to cut down the time frame that a complete test might require, and you be able to hone in on just one deficit at a time. Because in a hospital setting, your time frame with the client may be very small, whereas in a private clinic, um, you may have an hour up to 2 hours with the children, or you may see them multiple times throughout the week. Same with school setting. School setting may be a very structured and limited time frame if you're going actually into the classroom, or it may be a little bit longer if you've been provided the time to see that client out of the classroom and on a separate basis. Home, of course, you're working around the family schedule, and thus you may have 1 or 2 hours to see the client, or a full hour to complete an assessment. So, those are the things that vary with each different um, setting, and that's why I chose the Peabody or the Berry VMI or the sensory profile, um, that I believe would be able to be utilized across the board regardless of the setting that you're in. Again, my name is Kanisha Leggett with KUMSOT. Thank you for joining me today on Pediatric Assessments, Tools, and Settings. Have a great evening.